Okay, thank you for joining us this evening. I'm joined here by Dr. Alistair McConaughey, who's part of the clinical team at the Brownlee Hospital, Dr. Syed Ahmed of Health Protection Scotland, Shona Robison, the Health Secretary, Dr. Aileen Keel, the Acting Chief Medical Officer of Scotland, is also with us. I am unfortunately able to confirm that a patient who is currently being cared for in the Brownlee Infectious Diseases Unit at Gartnavel Hospital has tested positive for Ebola. The patient is a health worker who has been working with Ebola patients in West Africa. The patient returned to Glasgow late last night and, after feeling unwell, was admitted to hospital early this morning. The patient is currently stable and is in isolation at the Brownlee Hospital, pending transfer to the UK's high-level isolation hospital in London at the Royal Free Hospital. That transfer is currently being arranged and will take place in line with all of the appropriate protocols as soon as possible. I think it's very important to stress, particularly for the benefit of those watching, that the risk to other people as a result of this confirmed Ebola case is deemed to be extremely low. Given the early stage of diagnosis, the patient was displaying no symptoms of the kind that would lead to onward transmission and put other people at risk before she reported this morning as being unwell. However, as a very sensible precautionary measure, passengers on both the flight that came from Casablanca to Heathrow and the flight from Heathrow to Glasgow last night are being traced and contacted, and they will be given all appropriate advice and reassurance. Health Protection Scotland will be responsible for contacting the passengers on the flight that came into Glasgow late last night. Apart from other passengers on the flights and obviously the hospital staff since this patient's admission to hospital, the patient is thought to have had contact with only one other person in Scotland since returning to Scotland last night, and that person will also be contacted and given appropriate reassurance. The other piece of information that it is important to convey is that for anybody else who has any concerns at all, an information line has been established by NHS 24. The number for that information line is 08000 858 531. I, earlier on this evening, chaired a meeting of the Scottish Government's Resilience Committee. The purpose of that meeting was to ensure that the Scottish Government, in cooperation with all of our partners, are taking all of the appropriate steps that the public would expect us to be taking. I've also spoken earlier this evening to the Prime Minister, and we have obviously committed to both of our governments working extremely closely together. Scotland, it is important to say, has been preparing for this possibility from the beginning of the outbreak of Ebola in West Africa. I am confident that we are well prepared. We have very robust procedures in place to identify cases rapidly and also to ensure that any cases that are identified are then managed appropriately. These procedures have been tested very recently. Our health service has the expertise and the facilities in place to ensure that confirmed Ebola cases such as this one are contained and isolated effectively, minimising any potential spread of the disease. Scotland's health service has proven in the past that it is very well able to deal with infectious diseases such as swine flu in recent years, and I'm confident that we will be able to respond effectively again. So the key message is that all of the appropriate steps are being taken, but the risk to the general public is extremely low, to the point of negligible, and I think that message of reassurance is very important to convey this evening.